Good day. Today I will be presenting my research about exploring the life experiences of early childhood educators, the impact of school support system on mental health and teaching efficiency. To start off, the background of the study. So, teachers are the frontliners of Department of Education or the DepEd in delivering its curriculum, services, and skills mastery to the learners. The early childhood education initiatives in the Philippines aim to address the SDG 4 education goals for inclusive and equitable quality education for all children. It's according to AROSA 2024. So it is recognized as a critical phase in a child's development, laying the foundation for future learning and success. So the mental health and the stress level of teachers are two important factors that allows them to become holistic classroom managers and leaders. That's according to Jimenez 2021. So early childhood educators face a variety of challenges from addressing behavioral issues to managing diverse students' needs and at the same time dealing with the demand of communication with parents and handling the pressure of resources inside the classroom. And these issues may lead to stress and burnout, affecting teachers' ability to perform effectively and impacting the quality of education being delivered. Teacher mental health is a pressing concern in elementary and secondary schools, yet support for teacher well-being remains underexplored. Teacher support system, which includes counseling services, professional development programs, and peer support networks, are designed to reduce this demand. This study aims to provide additional insights into how the Philippines can support its educators. Despite the existence of school support systems such as counseling services, professional development opportunities, and peer networks, the effectiveness of these programs in addressing the mental health issues concerning ECE teachers remains underexplored. For the statement of the problem, this study explores the challenges early childhood educators or the ECEs face in their daily interactions with children and parents, and how these challenges impact their mental health. It also examines the role of school support system in addressing these issues. The first, what challenges do early childhood teachers face in their daily interactions with children and parents? Second, how do these challenges affect early childhood educators' mental health and well-being? Third, what school support systems are currently in place to assist teachers with these challenges? The fourth is how effective are these support systems in alleviating the mental health issues caused by these challenges? And the fifth is how do school support system influence the mental health of teachers and their teaching efficiency? For the theoretical framework, early childhood educators or the ECEs plays an important role in molding the development of young children, laying the groundwork for their intellectual, social, and emotional growth. However, ECEs in the Philippines have considerable problems, including managing varied students' requirements, dealing with classroom misbehaviors, and communicating effectively with parents. These problems may have detrimental influence on their mental health and instructional effectiveness. So appraisal theory will be used to explore how ECEs perceive and cope with stressors like classroom management and parent interactions. It focuses on how teachers evaluate situations as threats, challenges, and neutral events, and how these perceptions influence their emotional response and well-being. Another is the stress contagion model, examines how stress spreads within the social network. In the context of ECE, stress experienced by one teacher can impact colleagues, students, and parents. influencing the overall school environment and teacher well-being. Another is the social support theory that highlights the role of support systems such as colleagues, mentors, and administrators in helping the teacher cope with stress. So, this framework will explore how school support system within the school can buffer the negative effects of stress, thereby enhancing the teacher's mental health and job satisfaction. Significance of the study. So, this study holds significance for various stakeholders by addressing challenges faced by early childhood educators or the ECEs, their mental health, and the role of school support system in ensuring teaching efficiency. General public. This study would raise awareness about the struggles of early childhood education teachers and the importance of a robust school support system. Early childhood educators. This highlights the struggles of the ECE teachers, such as managing students' behavior, engaging with parents, and coping with unhealthy work environments and heavy workloads. Parents and guardians. So this study would provide knowledge to parents and guardians in the connection between their contribution to the challenges faced by the ECE teachers and the impact on the quality of education for their children. School administrators. The study will help administrators understand the relationship between school support system and the mental health of teachers and help them improve and implement facilities and policies that would foster a supportive work environment. Policymakers. This will guide policymakers for the future leaders in formulating ordinance, resolution, and regulations and programs specifically designed to cater the needs of ECE teachers that would address underlying problems involving their mental health and capacity. Future researchers. This study filled the gap in the literature by providing a comprehensive explanation of the interplay between the challenges faced by ECE teachers, the effects on their mental health, and the role of school support system in alleviating the burden carried by the teachers. For the scopes and limitations, this study focuses on the challenges early childhood education teachers face in private schools in the Philippines and how these challenges affect their mental health and teaching efficiency. For the scope, examines challenges faced by ECE teachers in private schools in the Philippines. It focuses on mental health, teaching efficiency, and the role of school support system. Data collected through interviews exploring teachers' experiences, support perceptions, and coping strategies. For the limitation, the study will only focuses only on private schools ECE teachers, excluding the public schools and other educational levels. Will also exclude personal and unrelated external factors affecting teachers. Findings are specific to private schools in the Philippines and may not be generalized to other settings or countries. So now we will go to the chapter 2, the review of the related literature. So the review contextualized the argument in the study that the challenges faced by early childhood educators and the availability of the support system significantly influence the mental health and teaching efficiency. So the section will be divided into the following: the conceptual literature, foreign studies, local studies, and the significance of related literature. The related review, early childhood education, ECE refers to the formal and informal educational programs designed for children from birth to around 8 years old. This critical period encompasses the years before formal schooling begins, typically up to age 6, although some definitions extend to age 8. That's according to Dr. Kapoor, 2018. According to UNICEF, despite the growing significance of ECE, this level of education still faces numerous challenges that hinders its effectiveness and accessibility. The area of early childhood education is always evolving, with new teaching methods, curriculum changes, and technology advances. Educators must respond swiftly to these changes, which can lead to stress and burnout. Research shows that early childhood educators' mental health must be prioritized, considering their critical role in molding young children's developmental paths and providing significant emotional support during their formative years. Research shows that the quality of education is affected by how teachers cope with the challenges faced in their line of work. Burnt out, exhaustion, and decreased job satisfaction are common consequences of prolonged exposure to unaddressed stressors, underscoring the urgent need for comprehensive support and resources to safeguard teachers' well-being and enhance early childhood development outcomes. Professional support measures such as mentoring, in-service training, or emotional supports are crucial for teachers to remain and continue working in school. In the realm of education, a strong support system is important for fostering student development. So, for the relevance of related literature and studies, teachers have been a central force in the facilitation of learning, playing a vital role in the education and care of students, according to Rabago Mingoa 2017. Too much work, insufficient salary, parent teacher interactions, and dealing with students' behavior are few of the stressors that affect the mental state of teachers. The body of related literature and studies is critical for understanding the complicated interaction between school support system, early childhood educators' mental health, and instructional efficiency. Literature on school support systems further illustrates the potential benefits of institutional interventions such as counseling, mentoring, peer support, and professional development. The related studies show how a research deficits in understanding the distinctive expression of early childhood educators in the Philippines. For the foreign local studies, teacher well-being or the TWD is a crucial issue for schools and societies. It is seen as relating to teaching effectiveness, students' outcomes, and educational government. That's according to Duckworth, Quinn, and Suleiman 2009, Sutton and Whitley 2003. Work-related stress is one of the most commonly cited variables affecting teachers' capacity to fulfill their duties, according to Koch, Solomon, and Paris 2018. According to the for Disease Control and Prevention, teachers and principals are more likely than other workers to report burnout and symptoms of depression. Mindfulness based training programs, self help workbooks, and creating a healthy work environment is crucial in ensuring the wellness of teachers and school staff. An assessment by Tagadiad, Granaderos, and Paglinawan of 2024 revealed that school support systems are essential in shaping teachers' competence. Now we go to the chapter 3, the methodology. For the chapter 3, we have here the research design. So this study employs a qualitative research design, specifically a phenomenological approach to explore a live experiences of early childhood educators in private schools. So this design is appropriate for examining the challenges faced by ECE teachers, their impact on mental health, and how school provided support system influence their teaching efficiency. So for the respondents of this study are early childhood educators teaching in private schools in Iloilo. So the respondents are selected through purposive sampling to choose respondents. The sampling focuses on educators to meet specific inclusion criteria, current ECE practitioners' experiences, willingness to participate. This study will utilize 6 to 12 participants for consideration to ensure that there is a sufficient data for an in-depth exploration of lived experiences with maintaining while maintaining manageability. So for the research instrument, the primary research instrument for this study will be semi-structured interviews designed to capture the life experiences of early childhood teachers regarding to the challenges they faced, how they affected their mental health and teaching efficiency, and the role of the school support system in alleviating this problem. And also a set of open-ended questions aligned with the study of objectives will be given to our respondents. So for the data collection procedure, the data collection procedure for this study will involve three crucial steps: the preparation, conducting interviews, and data management. Confidentiality will be maintained by using pseudonyms, and the participants will have the option to withdraw at any point without consequences. So for the data analysis, so the data collected from the interviews will be analyzed using semantic analysis. The first step is to analyze the data, next begin the process of initial coding, then proceed to theme development, and lastly is to interpret the themes, connecting them to the broader research objectives and the theoretical framework. And that ends my presentation. Thank you.